schools don't have enough resources to be able to support these kids. A lot of disabilities, as well as medical complications, aren't visible. When you're working with children and feeding, or you have a kid who comes into your clinic and they're only drinking formula or they're only eating 2 foods, it is extremely important to get a full workup evaluation.
All right, welcome, ladies and gentlemen, to another episode of Beyond the Science, where we dive into the intersection of behavior analysis and real-world impact. Today, we're talking about a critical but often overlooked topic: feeding therapy, food insecurity, and how behavior analysts can shape public health and school nutrition policies. Before we welcome our guests, I just want to welcome our co-hosts, Joseph Adams and Darius Cooper. We've been on the road here lately, fellas. Good to be back in studio. Let's talk about our guest today. I'm gonna try to not go too crazy on the accolades here.
Right.
Meara McMahon, for those of you guys who know her, she's a leading expert in feeding therapy, working in the intersection of behavior analysis, medical intervention, and public health. She's a clinical supervisor at Marcus Autism Center feeding program, where she works with a multidisciplinary teams of BCBAs, dietitians, speech language pathologists, and physicians to help children with complex feeding challenges. She was trained at Kennedy Krieger Institute and specialized in severe food aversions, medical-related feeding disorders, and achieving nutritional stability in food-insecure environments. But her work doesn't stop there. At Clinical Intervention, she's also an advocate for diversity and inclusion in ABA. Through her leadership of organizations like Georgia Association for Behavior Analysis, she helps amplify diverse voices in the field and pushes for ABA's expansion beyond traditional applications. Now, you can check her work out at Marcus Autism Center and connect with her on LinkedIn. She has an impressive background, as you see. Fellas, welcome to the show.
Thank you. Appreciate it.
Yes. Well, I'm so glad we finally got you in here. It's funny. We met at GABA almost, what was that, about half a year ago now? More than a year ago?
Yeah.
Yeah. And we started having conversations, and I'm so glad that we can kind of come to fruition now.
It's such an honor. Thank you so much for inviting me on.
Thanks for being here. So we want to kind of get started, as we always do with our guests. And if you can just tell our amazing listeners a little bit about yourself, kind of what got you into the field, and we'll go from there.
Yeah, absolutely. I got into the field with a little bit of luck and a lot of hard work, but started off in undergrad at Drake University in Des Moines, Iowa. I worked with an incredible researcher, Maria Valdivinos. She studies the intersection of challenging behavior and psychotropic medication changes. Worked and did research on her NIH grant as an undergraduate student, and got to work with adults with intellectual and developmental disabilities in the greater Des Moines, Iowa communities. Adult population got kind of a little depressing, and I was like, all right, I want to work with kids. How do I do that? At the time, at the Iowa Department of Education, Sean Casey was sort of head of the challenging behavior unit, but he also dabbled in feeding. He worked with Linda Cooper Brown at University of Iowa. So he sort of took me under his wing and was like, let me introduce you to pediatric feeding disorders. And I was sold immediately. I loved the aspect of getting outside of the field of autism, getting into medical aspects of feeding, the multidisciplinary aspect. And so I went and ended up at Kennedy Krieger Institute, was a direct therapist. So I've been there, before RBTs, I guess, but I've been there, and then was able to get my master's at University of Maryland, Baltimore County, and then connected with my current mentor at the time, or now, Valerie Volkert, and she was like, you need to go get licensed as a psychologist, because being in the medical field, there's a lot of, we're getting better. Behavior analysts are breaking into that space. But at the time, there was more honor towards like psychologists. And so I ended up at the University of Georgia. Go Dogs.
Go Dogs. Go. Sorry, I was going to go crazy.
Can we cut that out, please?
Go crazy, Meara.
Yeah. Ended up at University of Georgia working with Scott Ardwin, who's an academic intervention BCBAD in the school psychology program. But what I loved about UGA was that there is also a special education program there with Doctors Kevin Ayers, Joel Ringdahl, Rachel Cagliani, and they all kind of made my experience there to be able to continue to work with behavior analysts in different areas of the field. But then I just came back to feeding. I got pulled right back into feeding. And so when you go through like an APA accredited site, you go through the match. And so I matched at Marcus, and I've been here ever since, so 2020.
Wow. Awesome. How you like Georgia?
Georgia grew on me. Georgia grew on me. I loved Baltimore.
Yeah.
I don't know why Baltimore gets such, well, I know why Baltimore gets such a bad rep, but I loved Baltimore so much. But yeah, Georgia's grown on me a lot, and I've really grown to love the Atlanta area, the people here, so.
I always love it because, you don't meet a lot of people that's actually here. This guy over here is from New York. How you liking it here, Coop?
I love it, man. I tell people I give it a 10 out of 10.
Ooh.
Whoa.
Coming from a New Yorker,
I mean, New York is always going to be home, but, every city from Atlanta, Miami, Houston, every city got its own vibe, but it's a lot of just Black excellence out here in Atlanta, and the entrepreneurship is dope, the networking is dope, so, I'm a big son. New York will always be number one, but I'm a big son.
Nah, don't try to throw New York number one. I hear all the people here, he said Atlanta's better.
I didn't say Atlanta was better now. I didn't say it was better.
Well, wait, I grew up just north of Chicago, so.
Ooh, okay. I love
I'm
it.
a Midwestern girl, but Chicago's not really Midwest.
Well, yeah. I mean, I love Chicago. I got a lot of family in Evanston, so I used to go up there a lot.
Did I know this about you?
No, I don't think you did.
I grew up in Evanston.
Oh, wow.
Do we know people?
We probably know people that know people. We can talk about that up
Yeah.
So let me bring this back because something fascinating that you said is you came back to feeding. That was your passion. There's so much about feeding, what goes into it. And as BAs, and we have a lot of questions because, something that some of us may take on, but we need to have support from a multidisciplinary team. Can you talk to our listeners about why feeding is so complex?
Feeding really has that intersection of medical and nutritional pieces, as well as even like skill. And I mean even from like a skill safety standpoint with dysphagia and safety with swallowing. So all of these aspects that, as much as I would love as a behavior analyst to be able to get all of these different training opportunities within a 1 to 2 year period of coursework and to sit for my exam, we just don't have the expertise in those areas. And I think the other big piece is that everything is so internal when it comes to feeding. As behavior analysts, we know that private events exist, but we're looking for those external behaviors to work with kids. And so when we have ingestion of food, we have reactions. We're not really sure what's going on in here. And a kid can come and present as seemingly normal or typical or nothing looks medically wrong with them. But a lot of disabilities, as well as medical complications, aren't visible. And so it's really important for when you're working with children and feeding, or you have a kid who comes into your clinic and they're only drinking formula or they're only eating 2 foods, it is extremely important to get a full workup evaluation. And I've worked with, a lot of different practices and I've connected with a ton of different people in the feeding world. And what I've found is that even in many of cases, talking with that child's PCP is not enough.
No.
It's not enough.
Yeah.
I just attended the International Pediatric Feeding Disorders Conference hosted by Feeding Matters, which is an organization that, if any of your listeners are interested in feeding, it's an advocacy network that connects parents and practitioners. And the keynote speaker was incredible. He was talking, though, about how we as, he was a medical doctor, but how medical doctors don't have adequate training in even nutrition. Wow. And so when you go to your PCP or you take your child to your PCP and they're like, oh, they're fine. Or like, oh, they're kind of food selective, they'll grow out of it. Not, 8 out of 10 times, they might not have that full background to understand what that really means and what impact it could have on your child's health.
Wow, I just want to pause right there because I'm sure a lot of our listeners did not know that.
Yeah.
So when we go to our PCP, we're going and we assume that they have, especially when it comes to feeding, the knowledge in that area. So for our listeners who listen to that, so what would you recommend if that in those situations where they may have went to the PCP gave them some advice, but they don't necessarily have that that training overall in feeding? What would you recommend that parents do in that situation?
I think as parents, trust your gut. So many times parents come into our clinic and they were like, nobody believed me. Not my PCP, not my community.
Yes.
They're just like, oh, just take away the kids' favorite foods and hope that they eat. And these kids are going on hunger strikes for 3 days and you're like, I can't do that. And so trust your gut. Identify resources in your community. There was recently a paper published looking at the landscape of feeding. I believe it was Sharp 2024, and they identified 16 multidisciplinary intensive feeding programs. But reach out to those programs, get an evaluation, make sure that what you're worried about is actually reasonable, because I think a lot of that initial evaluation is going to validate a lot of your concerns about your child's eating problems.
Yeah. Wow. No, this is really good stuff. I know a lot of people listening right now, listeners, want this information, and we get it to hear first here from Meara. I want to go to you, Joe. What are your thoughts? What has your been experience when it's come to feeding, just kind of in your clinical practice? Have you had any challenges that you can kind of speak on personally?
Yeah, I'm dealing with actually a couple right now. I've got a kiddo who's about 6 who really doesn't eat. And he's in the kindergarten classroom, and there's a lot of behaviors that come around with that. But when he gets home, he eats. So can you talk to that? Because, my time in the school system, especially just as a student, right, there's a lot of plans associated to students that might be obese. But there's not a lot of school kind of interactions to students who really don't eat, because in the school system, like, you can't go use the microwave, right? You only have 25 minutes, and that cafeteria worker is on you about, hey, you got to get up. So, I've got this 6-year-old who just kind of picks at his food, doesn't really eat from like 8 o'clock until 3 o'clock, but when he's at home and we do home sessions, he's happy, he's engaged, but he's always kind of snacking at home.
Yes.
So,
you touched on 2 big pieces there. So the first one was my child doesn't eat in certain settings. That's a generalization issue. I think that's something that we can tackle, but it's going to be thinking outside of the box on how do we replicate certain things? How do we I use the term wean a lot because of tube feeds. And so, but wean, or, kind of get out of the home setting and into the school setting, have similar stimulus control, finding different ways if we present the same plates and the food is cut the same, to promote generalization. And then the other piece that I could get into a whole tangent about, but I won't, is schools don't have enough resources to be able to support these kids. And so when we have concerns about a child needing individualized feeding intervention because their food selectivity or their feeding disorder is so great, there is not, unless you build it into the IEP, and even if you do, there's not enough support in the schools to be able to serve some of these children. And so what I typically recommend, just to get by, is to send preferred foods or send kind of like a nutritionally complete shake that can kind of get that kid through the day, because you still, a kid shows up to school and you want them to be able to learn and not be hungry for the day. And so in order for them to use as much brain power as possible, they have to be nourished. And so aiming for, not skipping breakfast, which I don't know if we're all good at, but not skipping breakfast, and then making sure that anything that is sticking in the school is just, you got to get through the day.
So what if I don't, and this is just me asking questions right now, what if I don't have access to that? Like, what if I'm a single mom, and I think I brought this up kind of something similar to GABA, and I just don't have access to a lot of diverse foods. So I have to send my kid, I have to get my kid ready to get on the school bus. Elementary schools are like 6 o'clock in the morning. So that kid is just kind of waking up and going. So he or she may not eat breakfast, he or she does not eat a complete diverse diet, capacity breaks about 12. And these are the things that I'm telling the special education teacher and the assistant principal, like, hey, his capacity is breaking because he's malnourished. So we're dealing with, a behind the scenes issue. Can you allow this kiddo to eat at 9 versus 10:25 when lunch is? And 10:25 is early. So I have a lot of issues kind of with that, because you're asking this kid to eat at 10:25 for lunch and get on the school bus at 2.
Yeah, I before Meara jumps in, I appreciate that question, and we were kind of talking about this, all 4 of us, in our pre-show meeting yesterday, because you're touching on not just the picky eating, but the food insecurity.
Yes.
So I just want our listeners to pay attention to this answer, because I know this is something that a lot of people have questions about. Sorry to cut you off there, Meara, but yeah, please jump in and give us some insight and knowledge into that.
Absolutely. So with feeding disorders, you have kind of these overarching diagnoses of pediatric feeding disorders and avoidant restrictive food intake disorder. Pediatric feeding is more of a medical term. ARFID is the psychological one. Unique to ARFID, under the criteria, you by definition cannot be food insecure and have a feeding diagnosis of ARFID. And we can think about that in terms of as behavior analysts, creating opportunities to respond. If we don't create opportunities to respond, we're not going to be able to teach a skill. And so in the same way, if we're not creating opportunities for that child to eat a wider variety of foods, then we cannot say that they have a diagnosis of a restricted diet when it's actually food insecurity that is at play. The difficult part here, and again, some of this information kind of came from the Feeding Matters conference, but I have it written down. Dr. Kofi Essel presented on, how food insecurity can really exacerbate a feeding problem that is already kind of in the works. It can trigger it, it can exacerbate and make it worse, because you're not able to explore different foods. You don't create those opportunities to do that. And then even more so when it comes to food insecurity, even accessing in multidisciplinary treatment, you need to be able to travel to the different centers that offer it.
Yes.
When you're in the center, you need to, the center usually provides foods, at least the larger ones that I've worked at. But then once you're out of the center and you have kind of all these new foods on board, you need to be able to purchase them. And what's unique to children with feeding difficulties, and I think this also applies to, there's so much overlap, like it's something like 70 to 90% of kids on the spectrum also have feeding difficulties. The difficulty is that children with feeding difficulties often need like 8 to 15 times more attempts at trying these foods over and over and over again until we've decided that we can tolerate them or like them.
Got it. Yeah. Wow.
So let me ask, do you guys do like a focused parent training for this? Because I feel like in this conversation, the one thing that I hear as I kind of work with that is like the kids go home and then parents worked 8 hours, and it's easier to just give you chicken nuggets than it is to do what your BCBA just said and try to put 5 different options in front of you and that you're going to cry and yell about. So how important is the parent training portion of this?
We integrate, so I work at Marcus Autism Center in the multidisciplinary feeding program, and we try to have, it's an 8-week program. We try to have parents in by week 2 to 4. Somewhere in there.
Okay.
We're identifying an effective treatment for a child. We're making sure that we're getting parents involved right away. So we work on parent training and generalization within that kind of middle period so that the parent can follow their child's trajectory for the duration of their admission. And every change we make, we generalize. Change happens again, we generalize. And so it's extremely important both for the child to learn to eat, but also for the parent to get used to what their new life is going to look like. And Jerron, you went over the multidisciplinary team. Our registered dietitians meet with the family to see, well, what is your life going to look like when you leave? How do we integrate these protocol meals into your daily life in a way that works well? Once we graduate, we do a month check-in and we say, hey, does this plan still work for you? If it doesn't, let's pivot and try to figure out something else. And actually a huge discipline that we don't give enough credit to within our multidisciplinary team because they're not actively helping the kid to eat is our social work team, care coordination.
Oh, okay.
And so they are giving families access to grants and resources and getting them set up with food stamps, supporting Katie Beckett waivers and things like that. So it's helping parents to make the best of a bad situation potentially and try to set that child up for success long term.
Wow.
So
I love this.
I have another question. Now this kiddo's 17 and he just eats what he wants to eat. Like he might have had those feeding issues early, but he's kind of adapted to like, hey, I just like Coop just said, chicken nuggets and pizza. How does the intervention change there? Because he's a adult basically right now.
Yeah.
And you can't just say, I want, 5 things, try this. He's like, no, I don't want that. Like, how does that change as the kid ages?
Absolutely. I'm always going to recommend early intervention, early feeding intervention, if you will. And so when we have kids who have gotten older, and I'll be completely transparent at Marcus, we try our best not to use escape extinction, but there are cases in which it is medically necessary. If a child comes in and is malnourished, I'm probably going to be more likely to use escape extinction. And the number one goal for any child with a feeding disorder, feeding problem, is medical nutritional stability. So I think as, clinicians, we're trying to think about, as BCBAs, we're trying to think about like daily life skills and things like that.
Yep.
In feeding, we're talking about medical stability. So there's a couple of options. I would say getting him on a multivitamin. And they make some really delicious multivitamins nowadays.
Yummy for him too.
Yeah. There's liquid ones where you can kind of like hide it in something that they already drink or whatever.
Technology.
Yep, exactly. It's incredible. And the other piece of that is multivitamin to replenish nutrients that you're not receiving from food. And even we should all be taking multivitamins, are we?
Yeah, I am.
Okay, good.
I have to.
Yeah, I do too. And then in addition to that, there's for kids who maybe you can't get a multivitamin on board, I always recommend a nutritionally complete formula. So there's like Pediasure, Kate Farms is an all organic, non-dairy one, Boost and things like that. Yeah. Because a lot of the times the cool thing is that for certain children, insurance might pay for it. And so we were talking about food insecurity and wanting to make sure we're getting nutrition and volume on board. That is a great option that families might be able to get reimbursed. We've got a lot of kids I work with who are on feeding tubes, and all of their medical equipment and whatnot is covered through insurance. And I have kids who drink formula orally, and that's almost all that they drink, and it's covered through insurance. So thankfully, we don't have to worry about, in some cases, like where am I going to get this food? How am I going to find what my child might eat? They might not eat anything, or they might eat such a limited diet that at least we can cover them medically and nutritionally via a multivitamin or formula if they're not getting that volume and that robust nutrition workup.
I love this. You listen to Beyond the Science. We're live here in our studios in Atlanta with the brilliant Meara McMahon. This is a really interesting conversation for me because you touched on some things that honestly resonated with me, like for my childhood and a lot of people that I know. And it was being able to have access to certain foods. So growing up, I have a lot of family members and myself in general too, where we didn't necessarily come into contact with certain foods. So all we may have known would be the pizza, the chicken nuggets, peanut butter and jelly. So I was going to these fancy restaurants when I got older. I'm like, I just want chicken nuggets. Like, because I'm different now, but I hadn't come into contact with that. So when you were kind of stating that, it resonated with me because now that I'm at these places, but I haven't even had the learning history to be able to try. So my learning history is like, let's stick with what's normal, what's good. So when you were saying that, even when we're working with our kiddos and our learners, I can see how that's probably exacerbated times 10 in that situation for them. So thank you for speaking on that. And that ties into our school nutrition and public health. So listen, I want to dive into that because I know that's something that you want to talk about. I want to get into school lunches. Talk to us about the school lunches. I know you want to talk about the National School Lunch Program. To speak to our listeners about that and give us some insight.
Absolutely. So part of my interest in food insecurity is, well, we can achieve medical and nutritional stability, but what else can we do for these kids with the resources that we have? Mm-hmm. So I immediately, between getting my PhD in school psychology and then the intersection of feeding in school, and classroom management, intervention, I think behavior analysts need to get into the public health sector and also get into more of the special, take your special education expertise and bring it into the lunchroom area.
Yeah.
The National School Lunch Program is interesting because its development started from I think it was the mid 1940s, and it was developed because there was excess agricultural food that needed to be used. Okay. And the government was like, great, let's give it to these kids. And now we can help feed kids for a reduced cost. And how it developed was once we kind of used that excess, they were like, oh my gosh, what do? We need to keep on pulling in resources to this program now. They cut costs. And so they were having, kind of lower nutrition. There's really no nutritionists involved in that at the time. And so we were using kind of cheap food that led us to our obesity epidemic. So then the government hit back and was like, wait a second, we need to get public health and nutrition involved in a national school lunch program. And what I think is so cool about it is that, there's in some states, there's income levels that allow kids to get free and reduced lunch. In 9 states, free and reduced lunch is universal. And that takes out the stigma of receiving free and reduced lunch, which is so important for social emotional development. And it allows all kids, regardless of their income, to be able to receive a healthy meal. For some of our kids who are food insecure, that's the number one place where they're going to be able to eat.
Yeah. Yes.
But it doesn't help if we're also a little bit pickier. We haven't seen some of those foods before in our home. And so working on an intervention to be able to get these kids to eat this food is super fundamental. Right now, the current state, public health officials and nutritionists have been leading this journey. And most recently, I have read stories of chefs getting involved to kind of cook up something a little bit more delicious, because I'm not going to say that school lunches are the most beautiful looking meal in the world, right?
That chicken, egg, and gravy day on Tuesday. I was a high school teacher, guys. I know what it's like.
Exactly. So it's really cool to see these different disciplines coming together to promote use of the food that we're offering or that we're investing in these kids, and then reducing food waste overall. But we're still hitting a roadblock where there is a good bit of food waste in the National School Lunch Program because kids are not wanting to eat or choose to eat healthier foods. But when we have kids who are not willing to do something or who don't make good choices, who do we turn to? Probably not dietitians, probably not public health officials, but behavior analysts need to break into this area.
Yes, behavior analysts. And we were talking about that again during our pre-show meeting. We had a pretty passionate discussion. But no, that's really interesting, because BAs, I feel like that's where we could help.
Yes.
Right? I feel like that's where our science, our beautiful science that is, could come in and help. And that's something that we kind of want to urge our listeners. We want policymakers, we want people making decisions to hear this and know about it, because we do have this.
Listening?
Yeah, exactly. Because we do have this technology where this is where BAs could. So in an ideal world, what would that look like for you? If we were to step in, how would that look?
In an ideal world, I would envision probably behavior analysts integrating their knowledge of school systems, of class-wide behavior management interventions like the good behavior game, and integrating that into a school-wide kind of tier 1 supports for getting kids to eat the food that is presented. And I would say that, there are preliminary programs that have been explored. Food Dudes, I think, is out of the UK or Ireland, and There's been some work on, of course, in California on it, but nowhere else. But I think that even if we don't have a very specific program, there's opportunity for behavior analysts to work within their school systems to be able to offer support in this area. I think as behavior analysts too, we always kind of go back to like, well, shoot, how are we going to get paid? And so I sort of have a question for all of you as entrepreneurs as well in the field. I've really hit a wall in the sense of I'd love to get more involved in this kind of area and clinically and from a research standpoint, but insurance will not pay for a behavior analyst to go into the lunchroom and commandeer the entire area. So thinking outside the box on how we break into this space, whether it be writing grants to be able to partially pay for yourself is where I come, I'm sort of like, oh, write a grant about it, but you don't know if it's going to get funded. But so how, do we think about breaking into that area when there's not necessarily incentive to do so?
Yeah, no, that's a great question. And Coop is the guy who's always been innovative there. But I want to hop in real fast. What you mentioned is, I think, it's kind of rife in our field because some people may have the motivation to do certain things, but insurance or money doesn't cover it. So like the MO is there, but I'm not about to get paid for doing that. And that's what a lot of BAs, like even the work that we were talking about in our last episode with, shout out to Dr. Lindsay, a lot of work that she's doing in police officers, well, insurance is not going to pay for that. So that's where I feel like my brain starts twitching like, well, what can we do to be creative? And you mentioned grants. I think that's one area to explore. Again, don't always know if people are going to pay for those grants. One of my recommendations would be like, how much does a school care? Like, how much could we create the MO where it's like, can we put that in the school budget? Is there a situation where it's like it's important up to the school, so where it's like, okay, hey, this is actually a necessity, a mandate that goes around like for our kiddos, this is important to us. That can be in the school budget. But then thinking outside of that is how can we raise money to do the things that we want to do, and things of that nature. But Alex, I'll kick it to you, Koo. What do you think? How can we be creative in that situation, funding wise? You're the numbers guy.
Yes.
I mean, I think that it's tricky, as you venture into these other spaces in ABA, even with ABA versus to, we're trying to get into tech. I think the thing is that you have to kind of just be around the right people that believe. This is a field full of entrepreneurs and doctors and a lot of very successful people. And this is also a field where the networking is there. And there's just some things that, we're going to always be more passionate about it than other people, But when you have those relationships and the passion is there, I think that's kind of how you get funding for those things that are hard to get funding for usually. Yeah,
that is a good point. Bringing those people together, those policymakers, networking as we always talk about, really put something out there that would address this. No, that's a great point.
I mean, even the people close to you, you work at Marcus, I don't know how they're structured as far as, company with the CEO or, how personable they are. But, even with what I'm doing, I have friends that be like, hey, guys, I need 20,000. And it's like, oh, it's a lot, but like, does it make sense? And I think that, a lot of things that when you do try to venture into other spaces in ABA, I do think grants are an amazing option and they do give a lot of research grants. So if you can, frame it in that research frame, it's a little easier sometimes, but that's still hit or miss,
Yeah, no, man, that's good. And I'm sure as Joseph would probably say, having conversations like this, putting it out there, planting the seed first and foremost. Before we can even get to that level, let's get this stuff out there. Let's get people here. Let's have amazing guests like Meara on talking about this so that we can get that seed planted. So now I appreciate this conversation.
And I'll just tag on with that is like, we just take our data. Like you go to the local school board and you say, well, how much money are you spending for school lunch? Because food waste is... if you go to a high school, A, B, C, and D lunch, them kids just get it dumped.
Talk on a joke. That's real, man.
And I used to say, hey, man, let me get that orange. Let me get those Pop-Tarts. And I used to have a bunch of food for kids like in the morning or maybe like that mid-afternoon at 1 o'clock when that capacity breaks. So like you go in, you talk to the figure out the food budgets and say, hey, I could save you so much money if I put this intervention.
Talking money.
And
Yes.
it is millions. So when they realize, hey, okay, well, this is the data. Like, she could probably save us even this 50, 60, 100, 200,000. Like, that's how you can make
Yes,
it.
great point, Joe.
Absolutely.
Great point.
And
Great
getting
point.
parents involved too.
Yes.
I mean, if my kid could go to school and I knew that they were going to eat what was being served to them, I'd be saving money in my own pocket. And so that would lead me to attend a PTA meeting to advocate for that and push a school board toward buying into what you're offering.
Yes, I love it. All right, guys, this takes us to Straight Talk with Joe.
Yeah, so I was talking to, I'm going to call you Dr. Meara now. I was talking to Dr. Meara, and we were talking about things that she likes to do for self-care.
Yes.
I think self-care is important in any field. As a parent, as a child, anybody, self-care is super important. So, Meara, Saturday morning at 10 o'clock, you kind of like listen to Kendrick Lamar, like you go to the concert in April, Meara, you came back down. You go to the concert in April. Like, what do you like to do?
Oh, on the weekends. So I would say that, a lot of my interests intersect. So I'm super into food insecurity. I'm super into reducing food waste. I'm kind of an environmentalist. So I'll wake up, dump my compost into my composter, and then I like to get outside. And at least with the weather in Atlanta, it's not quite like the North anymore.
Not like New York.
It's beautiful outside for a very good chunk of the year. And so I like to get up to the North Georgia mountains and go hiking. I take both my cat and my dog hiking with me. Just we had to do a little bit of shaping to get my cat into a backpack because he's not super good on the leash. And then I'll also go for a bike ride and just kind of get out into the city. It's been beautiful and it's super fun.
I love that.
Do you walk your cat on a leash?
We worked on it, and then quickly the response effort became too high for myself to train him to do that well. So that's why he ended up in the backpack. But I do. He is sort of leash trained, but I don't want to claim that.
I do want to say that dog training is actually a passion of mine. For those of our listeners who are interested in that, highly recommend you guys read the book "Don't Shoot the Dog" by Karen Pryor and what Shamu taught me about life, love, and marriage. You guys heard of that book?
No.
Shout out to both of those authors. Amazing books. We're talking about clicker training. You said you clicker trained your cat, not your dog. Yeah. Clicker training is such an amazing way to train. It's one thing that I'm really passionate about. I've trained a few of my dogs, family dogs as well. So I love that. Using our principles and extending it.
Absolutely.
It's an amazing thing.
There's an NPR podcast, Hidden Brain, where they talked about training surgeons through clicker training.
Wow.
It's incredible.
Right,
and the
I
work
gotta write
that
that
Karen
one down.
Pryor did, and I think that's a great honor to her because she passed recently.
Yes.
So just awesome.
Yeah. No, shout out to Karen Pryor. I also want to give a shout out to Aubrey Daniels, father of OBM. Recently lost him a giant, and it's just done so much work. I'm big in the OBM space. So while we're honoring some giants in our field, I definitely want to give a shout out to Aubrey. Before we move to our favorite segment, I'm not coming to you yet. Not coming to you yet, Coop. I gotta talk about the work that you're doing at GABA.
The work that we're doing at GABA.
The work that we're doing at GABA, but the episode is on you. The episode is about you. So, but yes, the work that we're doing, and shout out to you because the big reason why I'm at GABA right now is because of you and Nadisha. So, thank you for bringing me on this amazing team. Can you quickly talk about? I know you're really passionate. Even in our meetings and stuff now, I see your passion. You speak with so much resolve, but you also are very intentional about the work that's being done with just being, diversity. It's everything that we do. Can you quickly speak to our listeners about the work that you're doing at GABA and why it's so important? Absolutely.
So I'm currently the co-VP of events for GABA. And so my primary duties are focusing on the conference, our annual conference, which is moving to October this year. So
pushing it up.
Save the date. And so, we're really thinking about how to bring in speakers and bring in diverse voices. Yes. And we're talking about culturally diverse and neurodiverse. Mm-hmm. And I think that, in 2020, Kayla Green kind of spearheaded and developed the diversity and inclusion chair and committee and whatnot. And that's the position that you are currently in as VP.
Yes.
And so being able to collaborate together to be able to both bring diversity to the conference and also have, that the spring series, if you want to talk a little bit about that.
Yeah, absolutely. First of all, thank you for the work that you're doing. DEI is a hot topic right now. We had Lakeisha Cobbs Hayes, shout out to her on recently, and she spoke so passionately about what that means to her. It's something I really align with, that it's not just an initiative, it's who we are. We walk it every day. You can't take that away from us. So my passion for the DEI work that I'm doing at GABA, and also shout out to Summer, who's helping me with this. We have a DEI series where we're bringing some phenomenal speakers on, some diverse speakers on to talk about various topics. We're going to be coming to you guys, giving it to you. Actually, we used to do it week by week, right? And now we're also doing it each month. So if you want to learn more about what we're doing, visit our socials on GABA, LinkedIn, Instagram. We're posting it out there. We have one coming up pretty soon here in a few weeks. So shout out to all the work that's being done at GABA. This DEI series is really important to us because we're really highlighting some diverse voices talking about some really amazing things. So you can visit us more at GABA, our website, our socials to learn more about that. But I want to give a big shout out to GABA and a big shout out to the work that you're doing as well. Thank you for that work. I appreciate it.
What is so interesting to me is how insane diversity is now become as a topic. And yet the number one piece of positive feedback we got from 2024's conference was the diversity of the speakers. So Georgia wants this.
Yes.
And we're not going to give in to whatever's happening in the rest of the universe. Because we want to deliver to our membership what they're asking for.
Yes, and shout out to GABA, man. Yeah, that was the first conference to really give us that big platform.
That's true.
That big space.
That was our first. Well, we had the studio and everything. Second. But shout out to GABA. GABA is doing it, man. I'm happy to serve. And man, you're just saying that is so important. Where our climate is right now, you gotta take a stance. And we like to be a little controversial on this show, but it's something that I'm passionate about. It's something that I walk and I lead with all my initiatives, that I do all my passion projects. So it's something that you're going to always hear me talk about, why it's necessary. And I think it's another reason why me and you vibe so well too, because I see that passion in you. And now I say, like, you have soldiers with you now. We're doing it. So I really appreciate the work that you're doing. I'm going to continue to do that work with you. And thank you for, being someone in this field who's advocating and doing that work.
Of course. But thank you to the three of you as well to bring that controversy to the forefront and to reach a larger audience. Because I'm over here on my computer during a board meeting, complaining, and you're having a full-blown conversation trying to reach everybody outside of the Georgia area.
Yes. No, thank you for that. And thank you for having me on recently at Marcus and doing a presentation. And these amazing brothers came on and we talked about our initiative. So a lot of shout outs to give here. But I'm going to give the people what they want. The people want their most favorite segment, even though Straight Talk with Joe was coming up. No. The trending segment on the show is Coops Off the Clock.
We could flow into it. These actually get scrapped pretty often, so.
Wait, can I share the Coops? You got it in there. I'm going to choose the Coops Off the Clock. That segment.
They don't make it sometimes, but that's okay. So we started off before we got on air talking about this Asian glow, right?
Ooh. Yes.
So, all right, I want you to tell us a crazy story or a night where the Asian glow was glowing. And you just ignored it. You said, "Hey, we outside tonight. I'm not gonna worry about it. We're gonna have fun. I'm gonna worry about it tomorrow."
Well, she gotta tell our listeners first what the Asian glow is.
Asian glow is first, and then you gotta tell us the story.
So Asian glow, Google it. You look up photos because I'm not about to show you it on the air right now. I will take a sip of this, but I'm not going to do it for the cameras. So I think it's a decent portion of East Asians don't have an enzyme necessary to break down alcohol. And so what happens is your blood kind of comes to the surface of your skin and gives you just this really like red hue. Yeah. For some people, it can be uncomfortable. For me, it just gets a little warm. Mm-hmm. So actually, I drink less in the South because of the weather, because it just makes me kind of hot. Mm-hmm. And so it happens, before anyone even gets like drunk, which is wild. And so you're walking around and people are like, oh, she's so wasted. And so in college, I used to be like more, cautious of it, but also just like aware and sort of embarrassed by it. Mm-hmm. And so
what Athens is on a Friday night.
Nobody going to Athens.
I love Athens. But yeah, so I would take, don't do this at home. I would take like off-label like Pepsid AC or something. It coats the stomach. It helps like reduce the absorption of the alcohol, helps reduce the Asian glow. When I got to Baltimore, was going out in like Fells Point, Fed Hill. Shout out to Baltimore. I didn't care anymore and would just, go kind of like walk the block and everything. But the best piece of it is that I can go out in, 6 feet of snow on the ground, middle of winter, and I feel fine outside. It gives me like that northern blood where like I don't feel cold.
Yeah, that's awesome.
And so I'm, running down the street or whatever, like wearing something that's probably should not be wearing in the wintertime after the bars. And it's great.
All right, guys. So if you see Asian woman running around in the winter with summer clothes on, we can probably identify. We can tag who that is.
Okay. But just know they're fine.
She's safe. Oh man. Well, listen. We might have to have you on again for a part 2. This has been a fascinating conversation. Thank you for enlightening us about just the things I know a lot of BAs want to know about. And you've given us so many gems. You've given us so much education today. But I want to ask you, first of all, before we get out of, where can our listeners connect with you? You're on LinkedIn. Where can they connect with you if they want?
I would say number one place would probably be LinkedIn. That's where I kind of keep my professional area. If you really dive deep into the literature and find my email somewhere in a correspondence section of a paper, you could probably find my email, but it's not readily available. Okay. So I'd say probably reach out via LinkedIn. Awesome. Well, fellas, this has been a fascinating conversation. This is something that we wanted to do for a while, so we appreciate you making the time to come and speak with us. I'll be seeing you here pretty much every month, and we're going to be seeing you at the GABA conference. Guys, get to the GABA conference. We moved it up a month this year, but we're going to put that out. I'll put some links in because did we announce this yet? Not yet. Okay, it's coming. Okay, I can't announce it yet, but it's coming to support these amazing initiatives. And Meara, thank you again for all the work that you're doing. I just want to clap it up for you one time. You're doing amazing work, and thank you for being willing to come on and have this conversation with our listeners. Welcome on whenever you want to come on. Absolutely. Thank you for the platform. Yes, and we appreciate you. So to our listeners, thank you for continuing to support us. You're going to see us coming up here. We're at APBS next week in September. We are the official podcast partner of that conference. It's going to be doing some amazing things. Continue to look out for all our initiatives that we have coming up. We're at conferences. We have some amazing speakers coming on and doing some great things. So thank you guys for supporting us. I'm always going to give a shout out to our TikTok followers. We reached our milestone on TikTok last week. So thank you for our followers. And guys, continue to stay curious. Continue to push our science forward. Conversations like these are super important. And until next time, we'll see you guys later. Thanks for listening.